Good evening, everybody. We would like to welcome you to day one of the Workplace Wellness Conclave, where we are recognizing the World Employee Appreciation Day today. Our latest initiative aims to assist in the development of mental health friendly workspaces. The conclave will take place across 2 days, featuring four engaging webinars to hold conversations around mental well being at workplaces, the hurdles at front, and suggestive measures to overcome these challenges. For our first webinar today on expressive arts therapy in the workplace, we have with us Devika Mehta Karan, who is the program head at St. Xavier's College, Mumbai, and the co-founder of Synchrony India. We are elated to have you with us today here. Over to you, Devika. We are ready whenever you are.
Thank you for that. So very quickly, just sharing the PPT. Okay, so just understanding expressive arts therapy at workplace, and both these terms sometimes feel like they're mutually exclusive because whenever we think of the word therapy, it feels like this is something that you get outside the workplace in your own personal time. When we think of the word arts, it sounds more like something that is a hobby. So again, it does not feel like it's a part of the work culture or of the space or the institution you're working with. So let's quickly look at what is it that we are seeing here. Yeah. So today we are just going to think about one, what is the definition of workplace, and how can arts and health intersect with this definition of a workplace? So when we think of the word workplace, what are some of the things that come to our mind? We think of corporate culture, we think of schools, of hospitals, we think of the word hustle, right? Where you come in, it's not essentially your space, you're coming in as an employee. So sometimes it's very hard to look at the workplace as something which is for your own personal well-being as well. When we look at the word health, right? What does the word health mean? A lot of workplace culture, when we look at it, even, when they approach us for any kind of help or support, they're essentially looking at those one-time workshops or a retreat format. It doesn't seem like something that is tangible, that is sustainable, that is going to happen over a longer period of time. And when we look at the word health, it sounds more like, what can we do to keep ourselves physically fit? So I do know that a lot of workplaces now have gym memberships or healthy eating cafeterias where, they serve healthy meals or diet plans to their employees. But then does the word health also include mental health, right? And there's so much stigma around this, and we'll come to that part later on when we are thinking about what are the challenges of having expressive arts therapy in a workplace. What do we mean by arts, right? I know so many of my colleagues, my dear friends who are all working in corporate sector, but when it comes to their own personal preferences, right, in terms of what do they enjoy, it always seems like it's supposed to be done post work, or it's supposed to happen on the weekend. So even the term self-care, right? When we think of that, yes, when you're working so hard, when you're working almost 40 to 60 hours a week, some are even working 80 hours a week. When you're working and putting in that much kind of effort, then where is the space for arts to then come into our lives, right? And when I say the word arts, a lot of times people presume that it is fine arts or it is actually creating something. But what about passive listening? What about going to a theater production and engaging ourselves as a witness? As at present, if we look at a lot of employees, we have Netflix, we have streaming options, YouTube, gaming options, all of them equally sedentary as our workplace culture is. So when we think of the word workplace, we do have stereotype ideas that it means sitting in front of a desk, having a 9 to 5 job or a job which has no time boundaries, having interaction only with the team members, where we don't give our own intrapersonal self any kind of information or any kind of value. We keep looking at it as, oh, I'm supposed to engage better with my team, or I'm supposed to be a leader. So everything is around productivity, or it is around communication, or it is around reducing conflict. But what about the conflict that we are engaging in our personal selves, where we may not be happy with the kind of work we are doing, or where we may not be able to find time to do anything for ourselves. So we're essentially then looking at not the concept of self-care through arts. Then we are looking at this concept of aftercare through arts, where we then come along and we say, okay, this is what I have experienced. I am burnt out. I'm exhausted. I do not have any space to be creative. And therefore, now I need to take some time out for myself. But what we are talking about today is integrating this within the workspace scenario, integrating this to understand and build communication, not just with people, but even within ourselves. So let's look at this intersection of arts, health, within what a workplace can be. A lot of times we're seen as, this has been my personal experience in a lot of organizations where we do go in and we're asked to consult. It always comes in as, we are inclusive, we are diverse, we promote creativity, we want everyone to be well, we are a big proponent of mental health. But then there is no scope for an in-house counselor. There is no scope for regular sessions that can benefit mental well-being of the employees. There is a lot of times these workshops happen, in the midst of the working day. So it's voluntary. Whoever wants to come, they can come. We don't force anybody. But why not force somebody to take care of mental health? Why not force somebody to say, no, this is a vital part of our culture, right? So a lot of times they say, yes, we need you to come in, but it feels like a tokenistic thing done by HR, or it feels like the employees as well as the employer do not value the mental health as it should be. And like we can see in the pandemic, it's become worse because we have experienced work boundaries and home boundaries blurring. Everyone's working from home. So where is the scope of then taking some time out and doing something additionally beyond this home work enmeshed scenario? So when we look at it, why expressive arts therapy? One, arts are universally inclusive, right? Anybody can engage in the practice of arts, whether I'm creating something, whether I'm witnessing, whether I'm an audience, whether I'm just trying something new out. They're inclusive and they do not discriminate. Arts are also catering to a diverse range of population. We are now seeing more and more neurodiverse individuals being employed within organizations. We are seeing, we are not looking at diversity just in terms of demographics, of race, of age, of gender, but we are also looking at diversity in sexuality, diversity in just about every aspect of how they want to be seen at a workplace. And then we look at arts as creativity, because everyone wants you to color within the lines in a corporate sector, but then they also want you to think out of the box. So how do we then create a balance between wanting to create and wanting to explore and innovate, but also remembering that we are still a part of a team and we are a part of a system that we have to follow? So what are some of the challenges that we are looking at when we think of workplace culture, right? We're going to spend a lot more time here because this then leads us to how expressive arts therapy can actually then cater to these things, right? So we have power dynamics, we have appraisals, we have enmeshment that happens, we have stigma, capitalism, and systemic barriers that are created. Let's start with the power dynamics. And how arts can help navigate through these power dynamics. One of the biggest things that is that, am I in the same therapy session or am I in the same workshop as my bosses? How do I then present myself? What can I say? How can I be in this space? So when we then look at expressive arts therapy, which allows you to be yourself, which focuses on bringing together how you want to be versus how you are, your real self and ideal self, being your true authentic self. When there are power dynamics in play, it becomes extremely, extremely difficult in a corporate culture to then work through that. So there are a couple of things that we do look at. And when we say power dynamics, we are looking at class power dynamics. We are looking at hierarchy that can happen because of designated positions. We can look at caste hierarchies, which are those subtle underlying power dynamics that are constantly existing, because you can then see cliques. You can see how some group of people tend to bully a different group of people in the workplace, whether it's passively aggressively done. So when we try and do sessions, then there is this constant simmering of power dynamics that we experience. Think about how can arts or expressive arts therapy can help there, is because when anyone comes into engaging with the arts, they're all at the same level, right? Because the goal here is not to create a product. The goal here is to engage with the process. The goal here is to look at how we can cohesively come together. How can we address some of the themes that we are experiencing, which are challenging to us within this culture, within our work culture, within our workplace. And I'm being very mindful here where I'm saying that this is not just something that happens in corporates. It happens in hospitals where doctors, therapists find it very hard to see eye to eye with the management. And there's so much conflict over there, or just simmering underlying issues which don't have a voice. And arts allows for that voice. It may be done in a symbolic way. It will be done in a non-judgmental way. But yes, there is scope for significant power dynamics to then show up and be worked through. We're not saying that power dynamics don't exist in the therapeutic setting. They do, but we are then looking at how can we work through that collaboratively. Second is appraisal. This is one of the things that we always get in the feedback, or we always have somebody come on the side and say, I'm due for appraisal next month. So even though I want to engage in this, I don't know if anything that I share in this space is going to then go outside the shared space and impact my appraisal, right? People are so scared, which we look at enmeshment and stigma, is how is this going to then impact how people see me in my workplace, right? So anything that we are looking at therapeutically then automatically comes with all these barriers which a person has to cross to even be able to show up in a group therapy setup, in an individual therapy setup, because they're constantly thinking of appraisal. When we look at enmeshment, right? This word enmeshment we are looking at in terms of is not just a blurring of boundaries. We are looking at how these boundaries are intricately connected to each other. So how I am in my personal life will spill over into my workplace. What is happening at workplace tends to spill over in our personal lives. And when we look at these enmeshed spaces, we're then also having, I have my personal life, I have my workplace life, but then I also have this group of people that I am friends with, but I also work with, right? So there's so many things that don't allow for an ideal, confidential, non-judgmental therapeutic space to then develop within a workspace. So it's something for us to think about, is how we can navigate through this enmeshment when we are looking at providing any kind of therapy, not just expressive arts, but any kind of therapy. One of the ways in which arts allows for this kind of enmeshment and is that it is symbolic in nature, right? So when I am engaging in any kind of visual art practice or movement practice, I then have the agency and the choice to show how much I feel comfortable in showing up, which then allows me to navigate this enmeshment. Stigma, I think, is one of the biggest things that we look at when we are looking at workplace culture, hustling. If I leave my space and I go to the counselor's room, what will that look like? Or if I sign up for this therapeutic workshop, what will that look like? Will people question my mental health and therefore my ability to make decisions, my ability to lead a team, my ability to then progress or ask for promotion, ask for more pay? How is this going to be perceived as? And which is why here, more and more, it is not something that just the employers can create, right? Yes, employers can provide opportunity. Yes, employers can say that we will pay for your mental health services. Yes, employers can say we will remove the systemic barriers, which we're going to talk next about, for you to be able to access mental well-being, or even just the concept of well-being, right? There is so much stigma around it because it's not just the employers, the employees and the work culture makes it equally hard. To give you an example, one of the spaces where we did look at, we had so many people who came in and said, we are just here to try it out. One of the things with stigma is also, they say that, can we not call this therapy? Can we call this wellness? Can we call this, something where we are looking at just engaging with expressive arts, and we are not looking at the word therapy. So even in a space where there are doctors, there are therapists, there are teachers, there are educators, there are MBA professionals, management professionals, none of them want to see the word therapy in workplace because of the stigma associated with it. And then when we think about if this can happen in educated spaces and literate spaces, what kind of scope does mental well-being have of being addressed in any other workspace? Capitalism, like I said, there is no space or no time allotted for mental wellness because every hour is billed. If your contract says 40 hours a week, you are milked for more than 40 hours a week. So there's no scope for you to say, can I remove an hour from this 40 hours in my paid time and take care of my mental health in the premises? Can I take some time out and go look for a mental health retreat? Anything that allows you to focus on mental health is then barged on and stomped on by capitalistic culture, where productivity is more important, efficiency is more important, and just physically being present sometimes is more important than being mentally present. Systemic barriers that we are looking at, look at it from this whole perspective. One, insurance, right? Mental health therapy sessions are not paid for. They're not covered for by most of the insurance spaces until and unless there's a proper diagnosed disorder. So a lot of times, until and unless you don't hit severe depression, you don't hit clinical depression, clinical anxiety, the access to mental health is very poor. When we look at a counselor, sort of being in the workplace, a lot of times the counselor is seen as the other, that he or she or they are not a part of our work culture, right? So just in case if I'm being sent to a therapist, I've had a hard week, I've lost a case, right? For those who are working in hospital setups, how does this look like then? That this specific therapeutic setup that is set up for the employees then gets discriminated against within the system itself. The third thing that we are looking at in systemic barriers is this lack of, like I talked about, that if you have mental health difficulties, it's your personal time, do it in your personal space. So one, there is very little financial availability in this capitalistic culture to allow for that. There is this othering of any kind of therapeutic or mental health services. People will happily go to the gym together after the day ends, but they won't say, hey, why don't we go for a session together, right? It's very hard to sort of look at it from that space. And third is this idea that if I need help, if I need support, then I'm not enough, right? I'm not going to be looked at the same way that anybody else is going to be looked at. So very quickly now, coming back to this concept of why expressive arts. Why do we need any kind of intersection of arts within the concept of well-being? So what does the word well-being mean? Take a moment and think about what is it to be well when we look at a workplace setup. I'm going to give you all a minute to sort of think about it and say, does it mean just physical wellness? Does it mean that I get covered by insurance? What are the different dimensions of well-being? Okay, so let's start off with the dimensions of well-being, starting with the physical one, right? Where the workplace experience does take care of, are we having a bio tracker or allowing for insurance for any kind of physical illness. We're seeing a lot more young people passing away because of stress. If you go to a doctor for a skin condition, they say it's stress. If you go to doctor for sleeplessness, insomnia, it's stress. So the word stress is stressed upon literally by every medical health professional when it comes to physical health. The second dimension of well-being is emotional, right? How are you coping with everything that is happening in the world? um, when we were living through the pandemic, literally the workplace expectation was, in a week you have to learn to do everything online, right? So there is no space for what is happening in this person's house. Does this person have the capacity to do this work from their house? What if the house is not a safe space for this young individual, and the whole point of them having a job is to leave that home space, which is not feeling emotionally safe for them, and to come and be productive in a physically separate space? So, emotional well being is most often overlooked at. If at all, they'll say, "Oh, she's not feeling very well," or "They are not feeling very well." But it's very hard to say, "I need a mental health day," right? There is no casual leave, or there is no paid leave for a mental health difficulty, or for a day when you just are not motivated to get out of bed to go to work and to actually work. The third kind of well-being is financial well-being, and this is where capitalist culture comes in. This is where urban setups face so much trouble, because especially if you're living in high-cost cities or high standard of living cities like Mumbai, if you're not working for 60 hours, you can barely make ends meet, right? So the kind of life that you want for yourself, it's very hard to get that with 4 days a week, right? Kind of work. So financial well-being, how can employers support financial well-being, um, allowing investments, creating spaces for people to come in and um, being insured, right? So that they are not constantly stressing about what if this happens, what if that happens. Then we look at social well-being, right? A lot of workspaces do not allow for fraternizing. They do not allow for any kind of within team social engagements. When you're looking at social engagements, either there is once in a year, twice in a year party, or there is this office gathering where individual teams go out. But how often do we feel comfortable as employees to engage socially or to do social events within our corporate spaces or within our workspaces? A lot of times that comes in as a force. Oh, I have to attend. What will my boss think? Or everyone's going to attend, therefore I have to attend. So, what is social well being then? What is engaging socially with the people that you spend 80 hours a week with, 60 hours a week with? What does that look like? I know I've been talking a lot about teams, right? But workplace can even have two individuals, right? And then how do those two individuals take care, especially startups, which are incredibly hard, where you see smaller teams working together? How do you, really allow for mental well-being when the pressure to perform is that high? Then we look at purpose, right? Well-being and purpose go very hand in hand, because what is the end goal of me engaging in this work, right? Is this meaningful to me? Is this purposeful to me? Am I making a difference? Am I doing something that I enjoy? What is this purpose that I'm looking at? We then look at intellectual uh, well-being, right? Am I being stimulated enough at my workplace? Am I being allowed to take the kind of risks that I want to take for growth to happen? Not just company growth, but even personal growth. Am I being allowed to try different things that can reduce the workload? Am I allowed to be efficient, right? Because sometimes there's so much red tape that the red tape takes over the efficiency. If there are better ways to do it, those ways are not heard out, right? So all of these different experiences of well-being, environmental well-being. Are you working in a space that is committed to climate sustainability? Are they looking at ways to reduce their impact on the climate? How am I feeling? Is there any greenery around, right? Am I being allowed to connect with nature? Is there a space for me to breathe, which is not just these four walls that I'm working in? So well-being has multiple dimensions. And now we're going to look at why is an employee wellness program important? before I can go into really how arts can address each of these points that we've mentioned, is one, employee wellness programs is because HR has decided there should be employee wellness, therefore we need to do it. Or there is this much money allocated in the company's account, therefore we have to engage. A lot of times they refuse to see that maybe an employee might prefer a mental health time over a raise. Maybe the employee wants to be able to be productive. So when they look at a wellness program, they're looking at reduced healthcare costs. They're saying, oh, the employee productivity will be higher by the end of it. Or they say sexual harassment is something that we have to address. Power dynamics is something we have to address. Therefore, it's a checklist item. They're hoping that the employees then become more motivated, more engaged. They will tend to stay longer at the company, which is the retention rate, right? There is improved retention because the company is then investing so much time and effort in training this individual and developing the business around this individual that retention rates can then work better. Easier to recruit when you say, hey, we have wellness programs, we have healthcare programs, we have very rarely will you say we have a mental health program. And it also looks better for the brand, right? Like a lot of brands engage in tokenism of sustainability, but if you actually see, they only recycle their trash beyond anything else. So when we look at arts and when we look at what then are the benefits of expressive arts therapy, what can expressive arts therapy look like in a workplace, right? What do you think can it look like? Does it mean that we have open mic nights? Does it mean that we have regular movie screenings? Does it mean that we have a dance night or a salsa night where people can come in and move together? Or a painting room where in the physical workplace, there is an area that is allocated to maybe listening to music loudly, that is maybe allocated, that has art materials around it where you can maybe take a break and go. So are we looking at actual arts as hobbies, or then are we looking at maybe having a therapist who allows for self-expression through the medium of arts, where you can go and say, okay, this is what I'm struggling with, this is the kind of space that I need, and therefore can the space be provided through arts, right? So let's look at power dynamics. A lot of the expressive arts initiatives that we do work in is a lot about social justice. It's about oppression, right? And oppression does exist in workspaces. So when we look at power dynamics, one of the workshops that I did with one of the hospitals where I work was bringing in the management and the therapists together and looking at it as from a workshop space and really opening up communication, where we played games. We literally played drama games, and we said we had one group of individuals who were the management saying no in different tonalities and with their bodies. And we had employees asking for benefits, but only through the word yes. And after a point, it got so difficult for the management to say no, where then we opened this dialogue of what happens, right, when employees are asking for leaves, when employees want things to work a certain way, but the management sees it to work more efficiently, a different way. How can we build those communication spaces? And one of the things that then came up through that was that there is no space for this discussion, because so much now happens via emails. So much happens via WhatsApp groups, where these conversations do not have a space for fleshing it out, for testing, for even being accommodated. And one of the things that did come out when we were looking at oppressive hierarchies or oppressive power structures is that the people who are asking from, so there are 5 or 6 tiers. So if A is asking from B, B has to ask this from C, and C has to ask this from D, and D has to ask it from E, who then has to approve it. So somewhere in that space, in all of that juggling, we drop the ball, right? Either it's exhaustive as a process, or it is something that is not given importance because it's lost in translation. So how do we then build communication where something that the top person is saying is actually translating down to the bottom, most hierarchical, somebody who's constantly asking for things, versus when they ask for it, how can it reach the top ring ranking officials, the CEOs, the COOs, the management positions that actually have this decision making power. We also then look at this concept of, when you're looking at personal growth, when you're looking at the purpose of well-being, we also look at how can, in dance therapy, there's something called as embodied decision making, right? So how can you tap into your own bodied wisdom to make decisions that are good for your team, to make decisions that are in line with the company ethos, to make decisions that allow for progress while staying ethical, while staying true to who you are, and while staying true to the kind of work you're doing. So you then bring in the body in these spaces. A lot of times we have stress management workshops, right? And these workshops then are looking at, if I have a sedentary job where I'm sitting in front of the computer all day, how can I work through this? There's guided visualizations, there is metaphorical work that can happen. Can I sit and just doodle for some time while I'm thinking about something, while I'm ruminating about a specific problem or something that I have to troubleshoot? How do I then bring in arts here? And 80% of the times, the things that people leave back is, oh, yes, I need to move between my two meetings. And sometimes having those 1 hour workshops makes no difference when we are looking at having therapeutic benefits which are long term. Um, Something for people to remember is that this is not something that you do only during the mental health week, or this is not something you do when there is an incident of self harm or depression in your corporate setup, in your workplace setup, even if it's a small startup. It is something that you have to sustain continuously so that the kind of wellness that we expect, the holistic wellness, is present. Yes, there are workspaces which offer bonuses where they say, okay, we'll give you these XYZ coupons, go get a massage, go for a yoga class, or we will call a Zumba instructor, right? But again, we are only focusing on the physical aspect of it. Yes, there is a little bit um, influx of, or if I'm feeling physically well, my mental wellness will get infected, will get affected. But when then are we looking at how can mental wellness impact their physical wellness, right? So something like a mindfulness based expressive arts program. So MBCT, which is mindfulness based cognitive therapy, is a 8 session program where, if you want, all the employees can sit with, can get themselves trained in mindfulness based practices. So why can't workspaces then invest in creating programs which are part of induction, where any new employee learns how to take care of themselves, where self care doesn't become aftercare, where we are not looking at it as only if you have a diagnosed illness, then only you can go to a therapist or you can go to a counselor. How can we look at workplace wellness through the arts, through music, through poetry writing, through therapy? How can we make it a preventative space as compared to a space where it becomes curative, where it looks like treatment, where it looks like it's different from my professional and my personal self? Something for all of us to leave with is, one, how important are arts for each of us? Two, if arts are a part of our workspace and our workplace, how is that going to impact our well being? And three, the most important is, how can expressive arts therapy come in as a preventive program rather than a one off workshop, a retreat, a tick mark on the checklist, or even just as, yes, we have this as an option? How can we look at employee well being through the arts, which are extremely easily accessible, which promote inclusivity, diversity, and creativity in a workspace? And with that, I leave you all to just think about, what would you like to have in your workspace if you had the capacity to build it? What do you want to ask of your employer today? which allows for arts to be a part of your life. And with that, let's see if we have any questions for how expressive arts therapy can look like at a workplace.
Hi, Devika. We have received a question from the audience.
Yes.
Can we address that?
Yes, of course.
Sure. Okay. Yeah, this says, does EA help teams to become creative? And if yes, then how?
So when we are looking at creativity and when we are looking at teams, right? One of the most common things is that we don't look at arts practices are extremely symbolic in nature. You can build on it, you can create something, you can create something together. But it is the process more than the product that allows for creativity to emerge. Because what is creativity based out of? It's based out of spontaneity, your ability to come up with solutions on the go. It involves play. So whenever there is play involved, there is a certain amount of lightness that comes with it that allows us to distance ourselves from the gravitas of the problem. It allows us to zoom in, to zoom out from the problem, to play with it, to create a dialogue that then allows for creativity to harness. And third is this idea that if we look at creativity as a process, right, and not as a product, then arts allows for that process to be supported. When you're tired, you can take a musical break. When when your eyes are tired, maybe sit with a piece of art and allow for moving away from the screen. Something that allows for perspective to develop. Something that allows for your mind to shift focus so that you can refocus. So yes, expressive arts and expressive arts therapy definitely helps with uh, teams to build creativity, to sustain creativity, because sometimes creativity resources do run out, right? We all are creative, but there are days when we're just not able to tap into it. So how can then arts and expressive arts therapy allow for that kind of movement to happen? Is something that expressive arts can help with.
There is also a second part to this, which further says that how else can it add value to an organization's bottom line?
Okay, so thank you for the using the word bottom line, because sometimes a lot of the work that we do does not even reach the bottom line. Okay, so let me give you an example of something that we did for in my workspace. We did for just the women employees, right? And it's very common on Women's Day. Only women employees are given this benefit of coming and doing expressive arts. And something that we noticed was um, that when we are looking at expressive arts therapy, when we are looking at how mental health impacts a certain hierarchy, right? So even in the bottom line, when we were talking about power dynamics, we were talking about how women still feel unseen, unheard, neglected by their male counterparts, even within the bottom line. So technically, you're getting paid the same, you're at the same position, how it can still impact how you are being seen and how you are being validated. And when you do have a therapeutic space to address that, when you have a therapeutic space to address that with your male counterparts as well in the same therapy session, what it allows for is a universality to develop, certain amount of cohesion to develop. You can voice what you want to communicate in ways that are actually beneficial to not just the growth of the organization, but even to feel grounded and centered when you do come to work, where you're not entering the workspace already exhausted, thinking about what is the day with these group of men going to look like, or what is, if it's a person who identifies and is from the queer community, they're looking around and they're thinking, what is my day going to look like when I'm seeing heteronormativity all around me. So yes, it impacts the bottom line, but it impacts the bottom line in a way where there is a space to voice out. There is a space for any kind of conflict that emerges from these hierarchies can be addressed. Even if we don't keep just the hierarchy in place, sometimes the bottom line is the one that does the most amount of work, and it allows expressive arts creates that space for you to look at yourself and not just look outwards, but also to look within, which otherwise we don't have the space for within our workspace. We might do it outside the workspace. We might wake up a little early and have a nice cup of tea very mindfully and prepare ourselves for the rest of the day. But how do you sustain that for a 10-hour or a 12-hour day? The only way to do that is if it's a part of your workspace as well. Do we have any more questions?
Yeah, we do have a few more questions. Okay, so the next question is, what are the ways in which we can expand this field of expressive arts into workplaces?
Okay, so one is push for an expressive arts therapist as an appointed position rather than only going and looking at it as, can you outsource your employees to us, or can we come into Women's Day? Can we come on World Mental Health Day and do something? Stop looking at it as a workshop. Stop looking at it as a retreat that can be offered. Look at developing programs that can sustain themselves throughout, where we are sort of looking at all year round, how can expressive arts be a part of the employee's life? So one of the things that one of the organizations where we did set up the program, we trained some of their in-house counselors to do this, is we set up 6 different programs, and the employees could sign up for a program at any given point of time. And every 3 months, a specific program would run, depending on the registration. And what they realized is that when there is a scope of choice, when the agency is given to the employees, they do make use of it, because they then start seeing the benefits and living the benefits, as compared to being offered expressive arts once in a year or twice in a year, just as a, as a reinforcement. So just something to think about is how it can become as integral a part of any organization, where even if you are physically not possible as an expressive arts therapist or a practitioner to go in, you still can go in and train in the programs that you have created within these workspaces. And the beauty of that arts is that it can mold to whatever the culture of that organization is, right? So we are not removing the culture of the organization by saying this is compulsory for everyone to do. We're saying let's adapt this to your organizational culture. And because it's arts, it's more easily done than if it was just a verbal conversation or if it is just a training manual. So something to think about is this adjustability that arts provides us to focus on when we are working in the larger space.
We also have another question. Can we take that up? Okay. So somebody has asked as to how can we as HR professionals introduce the idea of using expressive arts in our organization when we are talking about, say, its benefits and the advantages that come with expressive arts. How can we sort of introduce it?
So one of the things that I am very close friends with a lot of HR professionals from my own college days, and something that we've sort of been talking and back and forth about is either it can go bottom up, where you regularly do this for the employees and then they can demand it of the employers, or you keep doing it for the top echelons and it trickles down and they realize the benefits of it, and then they want to offer it to their staff. And this is what's happened in 2 of the spaces that we were affiliated with, where we were providing, where in one space we were providing it to the senior management, which was the supervisors, the principals, the educators, the everyone who makes the decision, the management essentially. And simultaneously in another space we were providing it to the, like we said, to the ones who are actually going to do all the work, who are spending way more hours in the company than the others. And what we saw is a 2-way trickle down. both ways works. One is where if the management removes time for this regularly, they'll see the benefits and they say, why don't you then offer this to our teachers? Why don't you then offer this to other staff members? Whereas here, where we were working with the employees, they say they consistently gave it a rating of 9 on 10 for mental health benefits. And then it became a part of their system. So it's something that you push for it to become a more consistent, even if it's once in 3 months, right? But it's still more consistent in doing it once in 6 months or once a year, where consistent application then allows for it to become a part of the system rather than the other, something that I spoke about quite early on, is this othering of any kind of therapeutic services. That she needs it, I don't need it, they need it, we don't need it, everyone needs it. Just that they haven't recognized it or they're refusing to recognize it in that moment. Right. So are we ready to close, or do we have time for one more question, I think, before the next person comes in?
Yeah, I think we can take another question here. Okay, so does expressive arts therapy help workspaces to become more creative in nature?
Creative, yes. Accepting, yes. Non-judgmental, yes. Communicative, yes. Really accepting of diversity, definitely. What it essentially does is it reminds you that there are parts of yourself that need nourishing. And if this nourishing can happen where you spend a majority of your time outside your personal space, there is nothing then that you cannot achieve. Uh, but that's the thing, right? There's so many barriers to this becoming a part of your daily life or your routine, that it's almost like saying, I want to be creative, but I don't have the time to spend the effort and the finances to spend in what it is to start creating. What do I need to engage in the process? So the product is more valuable than the process. And there is so much more value placed on what is the end result rather than how can I make it happen. So if you make it happen, the product will be valuable. But if you're constantly hoping for a valuable product to emerge without any focus on the process of what it takes to emerge, it's going to be hard. Yes for creativity, yes for inclusivity, yes for diversity, yes for acceptance in a workplace.
I think we had these many questions. Thank you so much for answering them. And thank you so much, Devika, for coming here today and taking us through the dynamics of expressive arts therapy in the workplace. And I am sure that our audience is taking back a new perspective today on how unique and new ways of working with psychological underpinnings can be effective in workspaces as well. So thank you so much for taking out some time for us.
Thank you. I just want everyone to think of is how can arts and health come together? That's all I want everyone to think about when they leave the space today. So thank you for that.